He's also criticized government's handling of COVID-19, saying the country's case count is likely to spike in the coming days because the lifting of the lockdown was not complemented with aggressive measures to contain the spread.
Especially if you look at the numbers. At the time we're lifting the lockdown, we had about 1,042 cases, right? Now we have more than 1,500 cases. 50% increment after 1 week. What's the way forward? There's no end in sight.
For it's a lost battle, and that the cases will continue.
I would not want to create any fear and panic in the system to suggest that it's a lost battle. But I believe that the president is not listening to wise counseling. The president is not ready to take everybody on board. The president is not putting public health science at the front burner. The president is considering other factors that, for me, should be relegated to the background and put public health science as the main factor or consideration for this COVID-19. But unfortunately, that is not being done. Because there are hospitals or health facilities complaining of lack of PPEs in the system. There are not adequate labs in the system. There are no adequate isolation centers in the system. You've heard about places or regions where they have been identifying schools to be isolation centers, and they've been met with all sorts of demonstrations and all that. And so I believe that this is where we should be. And then education on the ground. Yes, I agree that they've been engaging the people on television and on radio. But if you go to the grassroots, the people down there, to what extent have they been educated?
On the minority in parliament, the group says it is doubtful promises made by President Akufo-Addo to build 88 district hospitals will materialize anytime soon. They say there are no provisions for it in the budget, and processes to secure loans for the construction cannot materialize over the next 1 year. Minority spokesperson on health, Kwabena Mintah Akandoh, says the president's assurance is political talk, as the same promise was captured in the 2016 MPP manifesto. He is urging the president to desist from politicizing COVID-19 issues.
The construction of 88 hospitals has nothing to do with COVID-19. I don't think you want to, imply that COVID-19 is going to linger on for additional 1 year. You know, at this point in time, what I have realized is that His Excellency the President is hiding behind COVID-19 update to do general campaign, because he has realized that he hasn't gotten the opportunity to go to the field and campaign. And so that's exactly what he's doing, because if you refer to the page 33 of their 2016 manifesto, they indicated same that they were going to upgrade all district hospitals, and where there is none, build one. Unfortunately, 3.5 years is gone, and they have not done such a thing. And so we think that if you tell me you are going to use 1 year to construct 88 hospitals, it must be subjected to scrutiny. It's not going to be business as usual, just like before 2016 that they could say anything and then go scot-free. Now he's a president, so people are assessing based on what he has done. But my worry is that he's pushing all of us into the partisan political arena to start discussing issues like that, whilst we are not done with discussions on COVID-19.
Do you think it's a realistic plan to build up to 88 district hospitals over the next year or so, as the president has promised? Are there adequate provisions for
I have my own challenges. I have in my hands the 2020 budget. There's absolutely no provision for that 88 hospitals in the 2020 budget.
Mr. Akandoh is also urging the president to rather focus on completing health infrastructure projects started by former President Mahama.
What you do is that you have come to inherit a lot of uncompleted projects in the country. The projects are not properties of His Excellency the former president. It's for the good people of this country. We have a crisis at hand. And therefore what you do is to complete those projects. Okay? You to complete those projects and put them, operationalize and put them to full use. Then you think of adding more, because we need more. Okay, the former regime attempted to give not less than 6,000 beds, add 6,000 beds. You know, now the president's advisor on health is saying that we are looking at about 15,000 people, perishing as a result of COVID-19. If you ask yourself, how many beds do we have in this country?